A very pleasant good afternoon to our viewers. We wish to welcome you all to another edition of Let's Talk. We are delighted that you have chosen to view Let's Talk today. We are always very grateful. View Let's Talk today. And today we have a special program that we are commencing. We are going to be talking about taboo subjects that are important, but not very often discussed in public. These subjects pertain primarily to females, but are also very important to males. And we want to encourage the men to give attention to what we are going to be talking about, not just for today, by the way, but for the entire month of October. We are going to be sharing. Today, we are talking about menopause and sexual drives and sexual dysfunctions in both sexes, males and female. I have a panel of experts who I will introduce momentarily. But if you are joining us for the first time, we welcome you to Let's Talk. Let's Talk is a program sponsored by the South Leeward Conference of Seventh Adventists. I'm your host, Dr. Carson Greene, and we discuss issues ranging from anything to everything, issues impacting church members, issues impacting the wider community. We have in the past discussed all sorts of issues. We have discussed the whole concept of artificial insemination. We have looked at artificial intelligence. We have looked at genetically modified foods. We have looked at the vaccine. We have looked at Black people in the Bible, and any topic you can think about. We have been running this program for the last 3 years, so we have covered a wide range of subjects. And today we are dealing with something closer home. We are going to be talking about, as I mentioned, these taboo subjects. And today our subject is menstruation, sexual drives, sexual dysfunction. We would like to invite you to have a word of prayer with us, and then I'll introduce the guests. Shall we pray? Father, be with us as we go into today's Let's Talk. We thank you for those of our guests who have volunteered to be with us. We ask for your guidance and your directions, and be with also our listeners and viewers, and grant that the information will prove meaningful in Jesus' name. Amen. Well, friends, we have a large panel today, so we're going to move quickly. I want to introduce our guests to you. I'm going to begin with Dr. Nicole Roberts, who is a consultant gynecologist at the Sir Lester Bird Medical Center here in Antigua. We are delighted to have you on Let's Talk, Dr. Roberts. Welcome and good afternoon.
Good afternoon. Thank you for having me.
All right. In addition to Dr. Roberts, we have Dr. Giddel Thom, the only male on the panel this afternoon. Dr. Thom is in New Mexico. He is the chief medical officer of, I don't remember the institution, Dr. Thom. I know you do a lot of other things, but good afternoon and welcome.
Thank you, Dr. Carson, and I'm delighted to be here.
All right, thank you so much. Then we have Dr. Henry. Dr. Avenel Henry is no stranger to Let's Talk. She has been on, I think, twice before. We're delighted to have you with us, Dr. Henry. The last time you were in a different hospital. Now I understand that you are in Maryland. Welcome to Let's Talk.
Hi, good to be back. Thanks for having me.
Finally, we have, so far I've introduced to you 3 medical doctors. Our final doctor this afternoon is not a medical doctor, PhD in, I believe, family therapy, specializing in sexual dysfunction. We have Dr. Banjoko. I hope I called that name correctly. She is a professor at La Sierra University in California. We are delighted to have you with us. Good afternoon.
Thank you so much for having me. It's a pleasure.
Okay, wonderful. I'm so delighted to have all of you on Let's Talk this afternoon. We have quite a bit to cover, and so we're going to jump right into this discussion. I want to begin today with Dr. Roberts. You know, as a family life educator and marriage counselor, I encounter persons preparing for marriage and persons already married. So I do meet a wide spectrum of individuals. What amazes me, though, is the general lack of knowledge so many persons have regarding the anatomy of the human body, especially as it relates to sex and reproduction. There is general apprehension regarding talking about reproductive organs. Many of us can identify with that, at least in the Caribbean context. And this is why I want to begin with you, Dr. Roberts. So there is a lack of knowledge and how these organs function. Now, this is a Christian program. I'm a minister of the gospel, and the Bible instructs us that we were designed by God, made in his image. It seems to me that we should therefore not have any difficulty discussing God's creation. My first question is, why is it so important that we correctly identify body parts, and in particular, the sexual organs? And as a follow-up question, is the reluctance to openly discuss this topic, the taboo approach that I'm talking about here, that many have adopted along the way, is this negatively impacting our society today? Dr. Roberts, do you want to respond to that? I know I've said a mouthful.
No, absolutely. So you're right. There are a lot of people who are uncomfortable talking about their bodies, both referring to them by their anatomically correct terms, vagina, penis, things like that, and being open about the issues that they're facing. It makes it a lot harder as a healthcare provider to be able to help people who are afraid to talk about their bodies. It makes it a lot harder for people to understand what's normal and not normal if they're not comfortable having those conversations with the people that they're close to or the people that are around them, so your friends and your family. It makes it harder to identify issues in relationship and to delve into those issues. And we'll talk about that, I'm sure, a lot today. If you're uncomfortable communicating with your partner when there are things happening to your body that may be unexpected or different, or when you don't understand what's happening to your body. So I think programs like this are incredibly important for removing that stigma. Like you said, our bodies are God's creation. Our bodies are God's temple. Therefore, they are something that are sacred and that need to be taken care of. And you can't take care of something you're afraid to talk about. I do think that fear and that awkwardness that we are artificially creating around something that is more natural than almost anything that we do or deal with is causing a problem, because that shame leads people to hide things that can often be treated early if they mention them. That shame leads people to miss things that are abnormal because they assume, well, I don't like it, but it's happening, so it must be okay. You know, that shame can cause a lot of disruption in our lives, both personally and interpersonally. So yeah, I think even just starting with understanding what your anatomy is and how it functions is so incredibly important and is a huge part of what I do in a daily basis in my office.
Thank you so much. Appreciate that. Dr. Henry, you're also a gynecologist, and you operate in a different context. You are in North America, now in Maryland. Do you encounter situations where people are also a little timid to discuss body organs and name them correctly?
For sure, all of the time. I think, as Dr. Roberts was saying, it kind of comes, from prior to them seeing me, and sometimes it's awkward. I'm coming into this interaction just seeing someone for a couple of minutes. But a lot of it starts at home and in our social settings, and the church has a big part to play in that in terms of normalizing just education. Because if we think about it, as a church, most of the times we have almost unfiltered access to people's respect and to people's ear at least once, sometimes 2, 3, 4 times a week. And education is a big part of that. One other thing that I I've been thinking about often, and I thought about when Dr. Roberts was talking, was safety and the power of having correct knowledge as a tool to keep people safe. Because in this conversation with sex and sexual dysfunction, some of our listeners, may be triggered by some of the things that we are talking about. So just as a warning to anyone who's listening, but sometimes just the knowledge and just the education plays such a big part of trauma and preventing trauma in this area.
Well, I want to jump right into the subjects because we have quite a lot to cover. We have
Dr. Carson, before you go on, can I just make one little point here? And that is, it's not only this problem is not only about the patient. I think in healthcare itself, I find that it's so easy for us as healthcare providers to talk about everything else. But when it comes to talking about sexual health, about the genitalia, we find it a lot more difficult than talking about blood pressure and diabetes. And so when a new patient comes to us and they have a problem with diabetes, for example, it's easy for us to explain how the pancreas works. We explain all the details about their diabetes, how to take care of it, why therapy is important, what is important. But somehow, when it comes to taking that same approach to understanding the anatomy and the physiology, and to use that to explain to patients how their sexual health works, and get them to a point of understanding that and have those tools to make it better. I think sometimes as healthcare providers too, we find that difficult. And so it's a cultural thing, and it's not just a Caribbean thing. I think this goes through different regions, different places. And so we need to adopt that perspective of understanding the anatomy, understanding the physiology, and like everyone says here, or is saying, education. There need to be a complete overhaul of the approach that is being used currently.
Okay, thank you so much. Now, I'm going to come to Dr. Banjoko in a while, but before that, I want to go to the gynecologist. Because I want you to tell me about menstruation. I remember when I was a child, my mother had 9 children. I was the last, but we had a niece who lived with us from the time she was a baby. And we were home together one day. My mother wasn't at home, and she started getting her period for the first time. Of course, we didn't know what was wrong. We ran to the neighbor, a nice old lady who was next door, and she kept her inside for a little while. We were wondering what's going on, but she came out and said, "No problem, she's seen her flowers." And I did not understand what that meant. Nobody explained it, but I did not ask her what that meant. So this matter of menstruation, like I said, it's very taboo. I've come to realize that people have varying views regarding menstruation. Some see it as dirty, others as rendering women impure. Some believe that it is what disqualifies women from holding certain positions or offices. But before we deal with any of that, what exactly is menstruation? So, Dr. Roberts, can I start with you? What exactly is menstruation?
Sure. So inside the uterus, there is a lining that gets thick every month in preparation for pregnancy. If a woman does not become pregnant, that lining then gets shed, comes through the cervix out of the vagina, and that is what we see as a monthly period. It's a mixture of blood and uterine lining. When we think about menstruation, we use a couple of terms that I just want to throw out there so that people understand how to talk about it with their doctors and with each other. The menstrual cycle is the time from the start of your period, that flow of blood, until the start of the next period. So when your doctor asks you when your last period was, we're asking what was the last time you started bleeding, that first day. Your period, usually about 5 to 7 days, is the time when you're actively bleeding. And then you usually have somewhere between 2 and 3 weeks of a break between for a total cycle that's around 4 weeks long. Typically, you may have a little bit of cramping, but it really shouldn't be enough that it stops you from being able to function on a daily basis. Your bleeding typically will use on average about 3 to 4 pads a day. So if it's significantly heavier or it's making you feel lightheaded or weak, then that's something that's abnormal.
Okay, that's interesting. Thank you so much for that. Dr. Henry, let me jump to you now. What I heard Dr. Roberts say just now is that this is a normal, a regular bodily function, so to speak. And so the idea of a woman being dirty or unhealthy or unclean because of that, do we consider that to be fallacy? That's can you react to that if somebody says, well, you know, a woman should not do certain things because she's going to get her menstrual cycle?
Yeah, and I think, well, first, yes, as a blanket statement, that is a fallacy. We're describing something that is a normal reaction to hormones in the body, right? And it's just a part of God's creation and God's plan for how our bodies function. To the topic of saying that a menstrual cycle or experiencing a menstrual cycle somehow renders women unable to do different things, I think it is one and the same with what we started talking about, which was the concept of education and the big concept of shame. So in a lot of cultures, you know, things that we don't understand perhaps throughout the years, and the way that some societies are built and set up primarily around men, women have fallen by the wayside historically, and a lot of things that are misunderstood or not really clear have kind of been relegated to, you know, the side. And this is not to say that while a woman is experiencing that part of the menstrual cycle that Dr. Roberts was describing, when you're actually having bleeding and cramping, not to say that that is not a time that can be very unpleasant for a lot of women, and that there are different activities that they may decide to do and to not do. But the key part where it's different from being educated in something is the part where we're assuming that this has some relation to somebody's competence. And that's just not true, and it's just not biblical. I think that we as Christians have to always fight for, or remember that what we are fighting for is to show the world that we're made in the image of God. In Genesis, it says man and woman. So there's something about womanhood that is specifically about the image of God. And so when we say that somebody is incompetent or somebody that is, you know, just different from us without increasing our understanding, we should really stop to think and to ask God how we are slandering his creation, essentially.
Well, let me jump to Dr. Banjoko right now. You know, I do premarital counseling, and I sometimes ask one of the challenges that I encounter, not with premarital counseling, but with marriage counseling, is that when people are already married and they're having difficulties and they come to me, I often discover that their preparation for marriage was very limited, that they did not get proper or adequate counseling. Now, one of the questions I ask premarital couples is, you know, when can a woman become pregnant? If she gets start seeing her flow on this date in the month, when can she get pregnant? And more often than not, I get a wrong answer. My question to you, as a family therapist, and you know, why is it important that a subject like we are discussing this afternoon? Why is it important that not just women pay attention, but also men?
Yes, thank you so much. And that is so true. I also do premarital counseling, and I come across the same issue. And to be honest, I think what we started talking about is the main source of the problem, which is we can't even identify the parts of our body that engage in sexual reproduction. So how can we even talk about the process? And so like what, you know, the fellow doctors were saying earlier about like being able to name it, we don't recognize how much power it is in being able to name it. So just being able to be like, I have a penis, or being able to say, I have a vulva, that has a vagina. The vagina is not the vulva, and knowing the difference, right? Just knowing the difference between the vulva and the vagina already gives you half of the sexual education you need, right? And as whoever owns the body part too, it gives you a sense of power and ownership that this is mine. And we know how we feel about things that belong to us. We take care of it. We want to know more about it. We want to engage more in it. Because even when we think about the sexual development of humans, right? When we think about, if we're talking about like girls versus boys and how we develop sexually, there's something about being a boy and being able to learn how to potty train or use the bathroom for the first time. And, you're encouraged to hold your penis and aim it and, be able to use the bathroom properly. And we think about how women are socialized on potty training, for example. And it's kind of like, okay, if she puts her hand down there, it's like, you're just supposed to wipe real quick and take your hand out. The shame is already accompanying the female experience from the beginning. So when we now talk about two people trying to get married and they're trying to figure out this sexual thing, how much sexual education have you been given? Or is that even something that's we're talking about? Let's also be honest about how you've talked about sex within the church. And I say church, meaning like the big church in general, meaning that we kind of talk about sex as something to look forward to. I kind of call it the sexual prosperity gospel, is that we kind of sell marriage with the idea of sex. So sex becomes this thing that we keep waiting for, but we don't talk about it. Because if we talk about it, we're going to want it. And if we want it, we're going to do it. No one really talks to us about, if you have sexual urges, it doesn't mean you have to do anything with it. If you have sexual desire, it doesn't mean you have to do anything with it. So if we're so afraid about what sex will bring up in us, if we talk about it, we're going to wait till we're married before we can discuss it. Because then we can do all the things that are righteous and right with it, because we're afraid of handling it or talking about it or touching it before marriage. And a lot of my work is kind of breaking that down and being like, you can talk about attraction, you can talk about sex, you can talk about what sex could be like, you could talk about what sex is, even in premarital. And it doesn't mean that it's going to make you just like fall into quote unquote sin immediately just because you talked about it. But we have to admit that as a culture, we're very afraid of talking about it because we have this idea that if we talk about sex, we're going to do it. And that's actually not true.
I'm going to ask this question. I have been very specific before, but I'm going to leave this open to whoever wants to respond. I remember before I went into the ministry, and this is quite a while ago, I've been a minister of the gospel for 31 years plus. So I used to work in a bank, and in my department, we had males and females, and we used to have good times together. But there was this lady in particular. She was a young lady, of course. I was much younger then, but she would come in the office and she would say, well, Carson, listen, it's that time of the month. So, if you see me a little grumpy today, please understand, and that kind of thing. And some persons felt that she was a little too open to tell me certain things. I think she had the freedom of just sharing and discussing. But here's my question. As a man, do I need to be mindful of the fact, I may be a manager, I may be in an institution where I have people under me. Do I need to be mindful of the fact that a woman may be experiencing menstrual discomfort? Does that have any impact on her work, etc.? I don't know who wants to respond to that. I decided to leave that open.
Well, I was waiting on Dr. Tom to say something first, but I can go ahead and respond. So I think it's a very important word you just said in terms of mindful. Now, as Christians, and anytime we were wondering something, we wonder, okay, what to do? How should I act? How should I be? Look at Christ, right? And he modeled for us empathy and understanding and the strength of interpersonal connection. So if you are in a position of leadership and another human being who you work with tells you something about their experience, you can respect that. You can hold space for that. You can respond to them in a way that makes them feel heard. And that's not gender specific. If it is, because we've described the menstrual cycle as something that is so normal and so regular, just for context to people, if you think every woman that has been a teenager, that has been in her 20s, 30s, 40s, etc., has been experiencing this monthly for years, and if it at all hindered their ability to be able to function, then the world would literally collapse. So this means then that women, as they experience different changes throughout their menstrual cycles, not only physically, but hormonally and emotionally and other things. This does not keep them back from anything. And this does not stop them from accomplishing anything, from leading persons in any way. So if somebody chooses to share with you an experience, let's say like your story when you're at work, and they're just telling you how to serve them better, right? And Christ is encouraging us all to be servants and to love our fellow man more than ourselves. So I would say that person is just giving you information for how to serve them better, and you can choose to be Christ-like in that moment. But when you are a leader and you're evaluating who can get something done and who can accomplish something or make just any decision for your institution or for your group, then take them by the objective measures and let them lead that way. I don't think the menstrual cycle or anything about womanhood, historically, by the numbers, women have continued to do what they have to do all day, every day.
Well, Dr. Roberts.
Since Dr. Henry, since Dr. Henry asked me to, or thought I would say something about this, I would. It's very important to realize that, and I like what Dr. Henry says, this is not limited to sex or gender, because we all experience things in life. And one thing we need to understand, that you mentioned menstruation and you talk about that. We need to understand that this is not something that is experienced exactly the same way in each individual. We need to understand that this is not something that is experienced the same way in the same person from month to month. It does change, and it can change. And so we do go through things. And there are times when, there may be added burdens, added pressure, depending on what's going on in our individual lives. And so it makes it very important to understand people and to relate on a personal, interpersonal level for the benefit of the relationship that you're having with that person, whether it's one of manager to employee or it's interpersonal on the same level. We need to treat everybody with love, understanding, and respect. And so somebody going through a difficult time, whether it's because of added abdominal pain and colic, or because of whatever else it is, then we need to maintain that respect, that communication, and continue that, relationship with that person. There's nothing there that says that, it's totally different experience from anyone else, and we should respect that person for what they're going through and try to understand it as much as possible.
Now, I want to ask this question on, we're going to move on from menstruation in a little while, but I want to ask Dr. Roberts, we have a situation, or should I say, my observation rather, that in spite of the education that is given today, we still have a lot of teenage pregnancies. A lot has been said about contraceptives, etc., but we still have a lot of teenage pregnancies. And unfortunately, some of these persons who are becoming parents are very ill prepared for the parental role. And so you may have, if you have a 14-year-old or a 15-year-old giving birth to a baby, that individual should, in my opinion, in my estimation, should really still be enjoying their teenage life and socializing, etc. But now that the task of parenting is thrust upon them, they don't have time to complete development. Now they become parents. And one of the things is that how do they talk to their children about things like menstruation? Is there something that young people should know, parents in general should know about talking to their children about if the girls about menstruation? Is there anything like, if you start seeing your menstrual cycle at a certain age, these are the implications, etc. Can you speak to that a little bit, Dr. Roberts?
Well, that's a really broad question. I'll try not to drag it out too much. I think the first issue is menstruation and anticipating menstruation should be a discussion that starts well before it occurs. A lot of pediatricians do a really good job of this, starting to talk to young girls at 7, 8 about what's happening. When you start to see breast development, that's typically a good time to start warning young girls that there will be a time when this happens and helping them understand what to expect so that it's not a situation like your niece where it happens and there's complete confusion, I think a lot of the times parents, including young parents, don't know how to have that conversation. And that's what we're here for. I have definitely had moms bring their daughters to me because they've just started having their periods or they think it's coming soon and they just don't know how to help their daughters understand what to expect. I, as a third party that's not, as personally involved, can more comfortably have that conversation about, this is what this means. This also can start us on the conversation of talking about what pregnancy is and how pregnancy happens, because if you don't know how it happens, you may get blindsided by it. Because it's heartbreaking when we see, young girls who come in pregnant, especially when they come in so far along that they barely have time to prepare for what's about to happen. The other thing is, as we break down the stigma around menstruation around our bodies, it makes it easier to have the discussion about contraception. There are lots of misconceptions about birth control, but the problem is in those situations where we have young people who maybe don't understand what's happening or are having sex without understanding consequences, that can be a really important conversation to have, even as you're talking to them about abstinence and respecting their bodies and all of that, is how do I protect myself so that I don't end up in a situation like you talked about, where I lose a big chunk of my childhood unexpectedly. And I have to learn now how to raise a child when I myself have not finished growing up, So it's important, I think, for young people to know what's coming. I think it's important for young people to understand what it means for their bodies, for their fertility, for their future. And I think that sometimes that's a hard thing for some parents to do, and that's okay. That's what your pediatricians and your gynecologists are there for. We will help you through that process.
Dr. Banjoko, when you spoke just now, you mentioned sexual desires, sex drive. So we want to segue into that because this is another taboo subject, right? This matter of an individual is sexually active, it's amazing. I was overhearing a conversation in an office one day, and it was a group of ladies talking, and they were talking about the fact that they use condoms as contraceptive devices, and when they need to buy, they were saying, I feel a little strange going into a store and into a pharmacist or something and picking up condoms because people may look at me funny and may think that I'm promiscuous. So there is a lot of shame, quote unquote, around certain areas of sex. Sex drive is one of those things. I want you and maybe Dr. Thom, we can just share a bit on sex drive and is it normal? What should we do with it? How do we relate to it?
Yes, thank you. And yes, that's the reason why I have a job, is because even outside of the church, there's still a lot of shame around sex. When we talk about, I'll speak from my perspective, when I talk about sex in terms of sexual drives and desire, I just want to start off by even separating the two, because a lot of times we use them interchangeably. When we talk about sexual arousal, we're talking about physiologically, like your body, how your body responds to sexual stimuli. Sexual stimuli meaning it could be anything from seeing someone you're attracted to or hearing something or reading something or just having sexual urges, period. And then when we talk about sexual desire, we're now talking about psychologically, mentally, like you wanting to engage in a sexual activity, you wanting to engage in whatever sexual stimuli is being presented. So a lot of times when we talk about these things, we tend to use them interchangeably, but they're not the same, meaning I can have sexual desire, but actually I can't have sexual arousal. My body is not participating in whatever I needed to participate in, meaning, for example, I could want to have sex, but I may not be able to have an erection. Or it could actually be the opposite, which is why I am actually aroused. I can actually engage. However, I have no sexual desire. I have no desire to engage in any sexual activity. And so knowing the difference is really important, because a lot of times someone could be struggling with sexual arousal, but if they're confusing it with sexual desire, they're not getting the help that they need.
So that's interesting. And I'm glad you were able to break down those things, make the distinction clear: sexual desire, sexual arousal, as the case may be. Now, so I hear from what Dr. Banjoko said just now is that different persons have different reactions, and whether it be emotional, psychological, as the case may be. Dr. Thorpe, so is it, if an individual, if a man says that he has no desire for sex, is something wrong with him? Maybe I'm putting you on the spot with that one, because I do understand that most men tend to be aroused by the physical and tend in society, and maybe I'm imposing here societal views, because society would have us think that men are the aggressors. But go ahead and respond.
Yeah, so you're talking about sex drive, and let's get down to it. You're talking about libido, and that actually is an interest, very much like Dr. Joko is saying, in sexual activity. And it's totally different, and I think she eloquently put it, from having plans and all that about sex. Your libido has to do with many factors. And so there are things that can affect that interest in sex and the level of libido that one has. And so, yes, you can find men that have little or no interest in sex. And we live in a society, and we have to be very mindful of this, that can impact on the level of interest that one, or desire that one has for sexual activity. And so, as counselors, as medical people in the medical profession, we have to always bear in mind that, yes, there are people out there that, for whatever reason, it could be psychosocial, it could be medical, hormonal, there are myriad of causes that can impact not only sexual performance, but one desire to have sex. And so we have to be mindful about that.
Thank you so much. Now, in today's world, we have two opposing views regarding sex and sexual desires. The religious faiths tend to almost relegate sex to this matter of procreation. In this regard, many adopt the posture that it is okay for a man to have high sex desire, but women must not. Then we have the entertainment industry that sex sells, and so they go overboard with painting women as creatures of sex, and they want to sell a car. They have a woman half naked, advertising the vehicle as though if you buy the car, you're going to get the woman, that kind of thing. Here's my question as we look at these two contrasting views about sex drive. Should I look at a woman who has a high sex drive as bad as somebody who needs to get counseling? Let's clarify those issues. I don't know who wants to speak to that.
if I may.
Okay, go right ahead.
Thank you. What a topic. First of all, I just want to say that there's a verse that says, "My people perish for lack of knowledge." I want to start off by saying that, unfortunately, especially in the church, when we're looking at 1st century to 5th century church, we've done a really bad job of talking about female sexuality. As a society, to be honest, female sexual research, I would love to hear what the doctors have to add to this, but from my perspective, is pretty new. We just found out about the clitoris like a couple decades ago. So a lot of research and a lot of information has been given to us over the years, over the centuries, over time about male sexuality. So it makes sense that when we're talking about who is more sexually promiscuous or who has more desire, we're always going to bring up men first, unfortunately, because a lot of the research and a lot of the data is centered around male sexuality. Good thing is, a lot of research is being done in female sexuality now, and we're starting to realize that actually there's no big difference in the like we called it before, libido, or the desire between men and women. Actually, we are actually more on par. Some research may talk about how men are probably they're more like their sexual prime is probably around their teenage years to like their 20s. Women's sexual prime is turning around like 30s and 40s and things like that. But at the end of the day, we're still seeing that women and men do have sexual desire. And actually, it is pretty normal for a woman to have more sexual desire than her husband. I see it all the time in couples therapy. The issue, though, that we're not talking about is that there is like what, Doctor had said earlier about how there's things that can affect desire. And I think we don't talk about that enough. So for example, in my area of research, there's something known as the dual control model. And I just want to do a really quick plug. If you haven't read this book and you're a reader, it's called Come As You Are. It is an amazing, phenomenal book that kind of talks about the female sexual desire and arousal and everything. And I think all men should read this, and I make my men read it too, in terms of like just understanding the female body. But apart from that, what I'm trying to get to is there's so many things. There's what we call brakes and there's what we call accelerators. Brakes, for example, are like sexual suppressors. So what is in your life? What is happening? For some people, women and men, they could be out here, they could be at a point where they're like, oh, I really am feeling the urge to have sex right now. But for both of them, maybe a job thing came up. Maybe they found out they're going to have an interview. Maybe a child gets sick. Maybe there's a loss of a job. Maybe something happens. Maybe someone actually was participating sexually and they got ridiculed by their partner. All these things play a role, and then sexual desire drops. Now that person could be seen as somebody who's having low libido, but the truth is that if you've been in a stressful environment for so long, you may actually have regular libido or normal, whatever that may mean to the person. But because of what's going on with you, it is lowered. And for some people naturally have lower libido, some people naturally have higher libido. There's no shaming here. It's just what it is, what it is. But if you don't know your sexual accelerators, meaning what are the things that actually get you excited? For some people, maybe it's a clean house. Maybe a clean house is what has been keeping you from having sex. And then you clean the house and you realize, oh my gosh, I want sex all the time now. Like these are the little things that we don't realize. Maybe it's that you've only been eating one meal a day. Your body is famished. And then you start eating 3 meals a day. Like, wow, I want to have sex now. There's so many little things that affect how we show up sexually that we don't pay attention to that actually affects desire. But the truth is, women and men, we all have varying levels of sexual desire. And whether it's low, whether it's medium, whether it's high, these are all normal. Now, when it becomes a dysfunction is when it has been a certain way and you actually want something, but it's actually not happening. But we'll get to that eventually. But I'm just saying that in general, low, medium, high, these are all normal and it's all okay.
Now, I'm trying to manage the time here because we have 15 more minutes to finish this conversation. And I'm sure we want to get into sexual dysfunctions. So I'm going to go to our gynecologist. I'm pausing here just so that those who are viewing can do understand some terminologies. So both for Dr. Henry and for Dr. Roberts. Obstetrics and gynecology. What's the difference? Just for the benefit of our viewers.
I can make that real quick. Obstetrics is pregnancy care and gynecology is all other women's health care.
Okay, wonderful. Wonderful. Now, Dr. Henry, I almost forgot the question I was going to ask you. Sexual dysfunctions in females. Dr. Thorpe, get ready. I'm going to ask you about some men, and then, of course, we have the specialists who will come to with the tough things. But can you give us from the physiological perspective, what are some of the common sexual dysfunctions in females?
Okay, and so when we think about sexual dysfunction, to just paint this in big, broad categories, because I'm assuming that what we're trying to communicate is for anybody who is listening and is thinking, does this apply to me? There's kind of a lot of big baskets that sexual dysfunction medically that we, ask questions for and look at. And it's back to what Dr. Banjoko was saying about sex and the act of sex having multiple different branches and multiple different, you can kind of think of it like a web that's all coming together. So when we think about dysfunction, without getting too technical, there's dysfunctions that affect your interest in sex, be it the ways that you are thinking, the way that you are feeling in your body when you mention sex or when you are engaging with your partner talking about sex. So there can be problems with that. There can be problems with the act itself, like problems with pain, problems with your body responding in different ways, like different levels of hormones, muscular things, and nerve problems, etc. But those are problems, let's say, with your body actually acting out the acts that you're thinking about. Then there's problems with sexual dysfunction that can happen based on other health issues that you have. So be it the health issue itself or some medications that you could be on with the health issue. So that's another big basket of sexual dysfunction that can happen. And then there's problems with, okay, let's say you're engaging in the act, but in terms of satisfaction, and we're talking about like orgasmic disorders, etc. So just having problems with some of the acts. So these are all big baskets of sexual dysfunction. And kind of the point of the way that they're separated like this is just back to what we were saying at the very beginning about education and knowledge, and to know that if you are listening and you're thinking about, is something wrong with me? There's such a wide web that sexual dysfunction can cast, and there's such a big way that it all comes together. And so it can be, at several different points in that where there's something going wrong.
Okay, thanks so much for that comprehensive response. I want to zero in a little bit too. Before I go to Dr. Thorne and back to Dr. Banjoko, Dr. Roberts, there is this matter of, and I think Dr. Henry kind of touched on it briefly, but a lady may be sick and she may get prescribed some medications, and so there may be a side effect factor relating to sex. That I can understand. But is there some physiological, developmental issues that can impact ladies? I'm not talking about the psychosocial issues now. I'm talking about the anatomy, the physiological elements that can render a lady to not, let's say, I don't know whether pre-orgasmic, from a medical perspective, can we identify one or two things that may be common out there? Maybe there may not be any, but I'm asking.
No, there absolutely are. So, and a kind of obvious one is menopause. A lot of women, as they're going through menopause, will experience vaginal dryness that can make sex very painful. That can be a significant discouraging factor for women who want to be sexually active, because honestly, around the age of menopause, many women find that their desire for sex increases. Their children are out of the house. They now have time with their partner. They want to have more intimacy, but it can be difficult. And if they don't know that this is something that can happen, that this is a normal kind of byproduct of transitioning to another phase of life, they may end up avoiding something that's strongly desired when we have things we can do to help with that, We talk a lot about the psychosocial things that impact. So for example, having children can be a process during which, for hormonal reasons, and also because you don't sleep, you don't eat, you're focusing all of your time and energy on this little life, can really affect your intimate relationship with your partner. And we know intimacy is incredibly important for healthy relationships. So when we're talking about sexual dysfunction, we also have to think about how these changes are negatively impacting our patients. Just like Dr. Banjoko said, your libido, your desire, your drive for sex may be very high or very low, and that may be what is normal for you. If you are not a person who wants to have sex multiple times a day, every day, that does not mean there's something wrong with you, unless it's something that's causing you distress or interfering with your ability to have healthy relationship. So as people are listening, I want them to understand that while we're talking about these dysfunctions, difficulty with orgasm or arousal or desire or pain, that your experience is not necessarily pathologic. It really depends on how that experience is affecting your ability to have a satisfying romantic or sexual life. But yeah, there are a lot of medical things that can impact beyond just medications.
Thank you so much. Now we're gonna have to go quickly. There's a question. I think this is important enough. I want to ask it because someone of our viewers is really concerned. So I'm going to read this question, and whichever of you think best to respond. My niece doesn't see her period hold on, let me read again. My niece doesn't see her period every month. Sometimes she doesn't see it for close to a year. When she sees it, it comes for 2 weeks. Is this normal? She's 20 years old. Okay, I see Dr. Henry shaking her head.
Short answer, no. If she's not on medication that stops her from having a period, i.e. if it's not because her doctor did something, she should not be going a year without a period. Periods should be coming monthly unless you have some medically initiated reason for that. So she should be evaluated by a gynecologist.
Well, you know, I remember hearing of a reading of this article, real life story, where one of these pharmacies, the artificial intelligence, I think it was it I can't remember, Right Aid, I think it was, they predict whether or not a person is pregnant based on their purchases, etc. And they did actually send something to this home to offer baby products, and the father picked up the thing in the mail and became really angry and threatened to sue the pharmacy. When a month or two after, he had to go back and apologize because indeed his daughter was pregnant. So sometimes maybe there may be things happening that, but I won't go further with that one. All right, our time is limited here. So let's see if I can ask this question. We're talking about sexual dysfunctions. Dr. Thorpe, I wanted to very quickly, because I want to come to Banjoko with the psychosocial elements there. But well, let me ask you, there are healthy and unhealthy sexual desires. Is that correct? What would you consider to be unhealthy in terms of sex drive?
And that question is for me. So if someone is so obsessed with sex that they cannot do and it keeps them from doing those important day-to-day things in life, then yes, it's becoming an obsession now, and that's bad. That's unhealthy. So your sex drive should never take the place of doing, important things that needs to be done in life. So if you're spending 24/7 obsessing about sex and over sex, yeah, something is wrong.
Okay, wonderful. Now, Dr. Banjoko, as a sexual dysfunction specialist, what are some of the more common issues that you have to deal with?
Yeah, it's just like everything that the doctors have mentioned, pretty much all of that. For the most part, I think the ones I see the most will probably be around vaginismus, which is basically an inability involuntary contraction of the vaginal muscles, meaning that they cannot be penetrated or struggling with penetration. And then I see a lot of erectile dysfunction. So it could be anything from delayed ejaculation to, those two mainly. But those are the main ones that I do see for the most part.
Now, unfortunately, we're going to have to wrap it up here. I mean, there's a lot more that can be said. I do know that an hour goes by very quickly. And I tell folks here all the time, you know, this hour on Saturday afternoons has to be the shortest hour on the clock because we always run out of time. But next week, to our viewers, I want our viewers to pay attention to this. Next week, we're going to be talking about menopause. We're going to be talking about menopause and its impact on relationships. So viewers, we want you to bear this in mind. I want to give a special invitation to the men, to married men. We want to get a special invitation, you know, as a counselor. I'm saying this because a lot of men need to be mindful of a lot of things, but we're going to answer those next week. I also want to ask our viewers to note, those of you who are listening on SLC Adventists, we're asking you to stay tuned after the program because we're going to be connecting to the Bible Connections final over in St. Vincent. Those of you on SLC Adventists, we're going to ask you to switch to those of you who are on SLC Church channel, we're going to ask you to switch to SLC Adventists to follow the Bible Connections final. Remember, all week October, we're talking about these issues. So next week, as I mentioned, menstruation and implications for relationships. Then following that, we're going to be talking about breast cancer. And then we're going to talk about infertility. And then we will talk about the power of the cervix and understanding cervical cancer and what you can do to protect yourself. So October is a full month. We want you to join us all the time. That's all the time we have for today. I'm just going to ask all of our panelists just to share one high point, something you want the listeners to go with. So we're going to go according to the screen. We're going to begin with Dr. Henry, then Dr. Thorpe, then Dr. Roberts, and then Dr. Banjoko.
Well, if there's one thing, I would say we keep circling back to education and the importance, and just to encourage anybody who's listening, sexual dysfunction as manifested in marriage, a lot of the times has started building roots from previously. So as a church, as leaders, as parents, as friends, uncles, aunts, I would just like to encourage us to have conversation and to seek more education so that we can start to break down some of these barriers of shame so that people can live fuller, healthier sexual lives.
Okay, before we go, Dr. Thorpe, I may have made a mistake in saying what is next week. Next week is not menstruation. Next week is menopause. As you know, if you're listening and paying attention, we discussed menstruation this week. So next week is menopause. If I did make that error, I apologize. Dr. Thorpe?
Yeah, so I would like our viewers to understand, especially male, when we didn't talk much about male dysfunction today, but this is important. And one of the common male sexual dysfunction is erectile dysfunction. And there are a lot of research that goes into this. And one need to understand that, you know, basically we're talking about muscle, and muscle does basically two things, right? It contracts and it relaxes. When the penile muscle relaxes, it engorges and it fills up. When it contracts, then it squeezes all that blood out and it becomes flaccid. And there are medications out there, your phosphodiesterase 5 inhibitors, that actually goes to produce nitric oxide, as we know, that dilates the blood vessel to encourage engorgement. And if I'm going to add to the ladies' side, understanding that the anatomy and of the penis is very much like that of the clitoris, and it needs to relax their smooth muscles so that they can engorge. Blood can flow into them to cause it engorgement. Now, there are a number of reasons why this can be impeded. We're talking about a number of common medical issues that permeates our society, even in the Caribbean: high blood pressure, diabetes, depression, taking some medication to treat these things. These can all cause problems with that. And so you need to understand this. And we know, there is your sildenafil, which is your Viagra and your Cialis, these kind of medications, but it's more than that. So understand that you need to talk to someone, talk to your healthcare provider, and full conversation so you can understand the exact cause and then directed treatment towards that problem. A lot of sexual dysfunctions, there are solutions, but you need to ensure that you're having that open discussion. And as mentioned here over and over, you need to talk to your partner. That's where it starts, communicating with the partner.
We didn't get into a lot of that. And I'm going to talk to you all after the program to see, when we're going to continue this conversation, because there's some important things. I'm sure a lot of men out there want to know, is it safe for me to go and buy the Viagra and so on? But we will tell you next week when we will follow up. Dr. Roberts.
Hi, yeah, I would second Dr. Henry's statement, but also just emphasizing that sex is a normal, incredibly important part of a healthy romantic relationship. So it's important to talk about it. It's important to explore it because it's a necessary part of self-care and of developing intimacy. And to encourage people, if something seems wrong, ask questions, talk to your healthcare provider, talk to your partner. That's the only way you're going to be able to figure out what the issue is and how to address it.
Thank you so much. And finally, Dr. Banjoko.
Yeah, it's just what everyone said. And I'll add, I don't know who needs to hear this, but if you just got married and you've been struggling to have sex for the past couple of months or weeks or years, please, it is not God, it is not you. Please go get help and get someone that can evaluate what's going on. You could actually be struggling with vaginismus right now and not know it. So please definitely talk to someone about it, talk to a healthcare provider, please get help.
Okay, folks, thank you so much. I appreciate the input from all of you. Again, next week, we are going to be back. We're going to be talking about, we have a different lineup for next week, but we're going to be talking about menopause. And again, gentlemen, I want you to be a part of this, so plan for it. Again, for those of you who are listening on SLC Church channel, we ask you to switch to SLC Adventist, where we will be going live with the Bible Connections final. Thank you so much. It was a pleasure. Until next